Comedian Amy Schumer recently shared that she underwent a botched colonoscopy, a procedure that left her in physical pain and feeling entirely unlike herself. Her audience is already paying close attention to her medical status. Schumer recently detailed her battle with Cushing syndrome, a condition that caused severe facial swelling, and the subsequent 50-pound weight loss she underwent to manage her health. Schumer's account arrives 25 years after Katie Couric televised her own procedure to demonstrate its safety to millions of Americans. Millions rely on this routine sweep to prevent cancer, but when a high-profile patient reports a painful failure, it creates an information vacuum, forcing us to ask what actually happens inside the body when this procedure fails. This chart shows the statistical reality. We see a 99.72% success rate, leaving a 0.28% sliver of rare adverse events. When complications occur in that margin, they manifest as three specific failures: cardiopulmonary issues, a perforation, or a severe bleed. To understand a botched procedure, we have to look past the headlines and examine the physical biomechanics of the colon itself. The first major risk takes place outside the colon, driven by how the body reacts to sedation. Excessive sedation can suppress the respiratory system, triggering hypoxia, a lack of oxygen, or cause a severe drop in blood pressure. There is also the vasovagal response. If the endoscope navigates a tricky, unusually short segment of the colon, the resulting physical pain can overstimulate the vagus nerve, causing the heart rate to suddenly drop. This demonstrates how closely the gut and heart are linked. A physical irritation inside the bowel can disrupt the body's cardiovascular stability if the patient's vitals aren't perfectly monitored. The second failure category is perforation. This occurs when the medical tools physically tear a hole through the bowel wall. The first mechanism is mechanical trauma. The endoscope pushes against the mucosal lining, stretching the tissue past its breaking point. The second mechanism is barotrauma. To get a clear view, doctors pump air into the colon. If they pump too much, they can overinflate the tissue until it fails. Look at this bar chart comparing a standard diagnostic sweep against an operative procedure. Removing a polyp with a snare raises the perforation risk to 0.17%. A tear creates a medical emergency, as intestinal contents leak into the body cavity and create a risk of infection. The third category is severe bleeding, occurring almost exclusively when doctors locate and remove precancerous polyps. To remove these growths, an endoscopist uses a wire snare charged with electricity to slice the polyp off the colon wall. The type of electrical current determines the risk. A cutting current can trigger immediate bleeding on the table, while a pure coagulation current can damage tissue in a way that causes delayed bleeding weeks later. As shown in this line graph, for every single millimeter a polyp increases in size, the mathematical risk of a hemorrhage jumps by 9%. Removing a polyp creates a site of local tissue damage inside the colon that must heal as the patient returns to their normal life. If a patient suffers a massive bleed or a bowel tear, are they destined for invasive open surgery? Endoscopists carry an internal rescue toolkit, allowing them to fix many of these failures from the inside out. In a chemical rescue, doctors can inject adrenaline directly into the colon wall to constrict blood vessels and halt a hemorrhage. For a mechanical rescue, doctors deploy an over-the-scope clip, or OTSC, constructed out of a shape memory metal called nitinol. This device acts like a microscopic bear trap, snapping the hole completely shut from the inside with a 95% success rate. Endoscopic tools have evolved so that doctors can now instantly patch the exact injuries their own cameras might cause. While Schumer's account of a botched procedure is a serious medical setback, the overall procedure-related mortality rate remains at 0.09%. Patients must weigh the rare risk of a surgical anomaly against the success of detecting colon cancer in its earliest, most treatable stages. Do the life-saving benefits outweigh these statistical outliers? Let us know your thoughts in the comments below.